Hi, I'm Simon Wade, student of physical therapy. Today we're working on our plan of care for Mr. Webster, 63-year-old male with diabetes, wound on his left foot, edema in that left lower extremity, some tachycardia, and some other things going on. One of the first things I want to do is perform a Wells criteria and see if possibly Mr. Webster needs further D-dimer testing, ultrasound imaging, or anticoagulation medication just to assess the risk for DVT. Moving on to treatment and plan of care for his ulcer in his left toe. It appears, based on what we're told, he's got dry, scaly skin. It could be a wound caused by an arterial insufficiency. I'd want to perform an ABI to see what his arterial status is. If he comes back with ABI greater than 1.1, which is possible because of diabetic calcification, I could perform a Ruber of dependency test. Based on these findings, we might find that compression is contraindicated to treat the edema in that lower extremity. As far as dressing the wound, we want to promote a moist wound environment. So I could use a hydrogel as well as a gauze on this wound. The patient is homeless, so likely not going to have a lot of medical attention. So if there's any necrotic tissue, I would want to focus on an autolytic debridement so that this patient could take home with his dressings for his wound. If the status of his arterial insufficiency confirms no compression, I'm going to want to make sure that the patient's footwear is not tight, he's not using any compression stocking, and I'm going to want to encourage him to offload that lower extremity as much as possible because compression is not going to help the wound healing for that ulcer. Based on the findings, it looks like his resting heart rate and respiratory rate are really high. It says he has a sinus tachycardia, so I'd like this patient to see a cardiologist to make sure they're cleared for exercise with me. If they come back cleared, I'd like to work on some cardiovascular exercise and some endurance training and really keep an eye on this patient's vital signs, make sure they stay within safe limits. I'm going to want to do some education with this patient. I want them to be as self-sufficient as possible in the management of their diabetes. So I'm going to want to go over the signs and symptoms of hypo and hyperglycemia, making sure he knows that if he's find himself going to the bathroom often and thirsty, this could be a sign that he has high blood sugar. And if he finds himself with blurry vision and a headache and a foggy headed, this could be low blood sugar. Obviously would like to, if possible, have him referred to have his diabetes better managed. Don't know if that's possible since he is homeless. So like I said, I want him to be as self-sufficient as possible here. I also want to go over some education on his wound so he knows what to look for, if it's healing properly or not, because we don't want that wound to deteriorate. We're going to go over signs and symptoms of infection and what a normal peri-wound should look like. So that way he knows to check back with me if things start to worsen on that wound. It's mentioned that he has a high fall risk, and I'm going to want to better understand what's going on in terms of this fall risk. So I'd like to perform a Berg balance scale assessment with him, and based on this, I might find that he needs an assistive device. We could fit him for a front-wheeled walker. Also, I'm going to get to observe some areas of where his balance is compromised during this test, and I'm going to turn some of those tests into actual interventions, working on semi-tandem stance, tandem stance, as single leg stance, eyes open and eyes closed. As we progress through this plan of care, I'm going to work from static to dynamic balance, as well as incorporating perturbations so we can work on his ankle, hip, and step strategies for balance. We'd like to see this patient, also want to assess the patient's lower extremity strength as it relates to his balance. Any muscles indicating less than a 5 of 5 manual muscle test. We're going to incorporate some resistance training and strength training into our plan of care. We'd like to see this patient at least 3 times a week for 60 minutes. This gives us enough time to recover from DOMS, soreness from the resistance training. Our short-term goals with this patient is going to be, we want to see him demonstrating competence in his self-wound care. I'd like him to verbalize the signs and symptoms of high and low blood sugar. And I'd like him to leave our first visit competent with his assistive device. Our long-term goals are going to be to reduce his fall risk so he scores well on the Berg. We want to see his arterial insufficiency improve so that he is above 0.9 on the ABI or not showing poor results on the Rublev dependency test. We'd like to see his wound fully healed, and we're going to increase all of his lower extremity MMTs so that he's at a point of a 5 out of 5 on all of those. And one of the last things we want to work on with this patient is indicates that he's got some mental health issues and depression based on life circumstances. So we're going to try to really be there for this patient as a health practitioner, but recognizing the limits of our scope of work, we're going to refer out for mental health based on what he can do. And lastly, it sounds like his biggest point of contact right now is his nurse at the homeless shelter. I'd like to be in contact with that healthcare provider and letting them know the findings that we're receiving on these tests, and really working together to help Mr. Webster's overall health get back better. Thank you.